So I want to put some of these mortality risks into context. So when I say that people with a cannabis use disorder have nearly triple the likelihood of premature death within 5 years compared to the general population, that premature death risk linked with cannabis use disorder is slightly lower than what you see from alcohol use disorder. But I think that one of the important takeaways from this is that that risk and our understanding of that risk really challenges some of the more widely held beliefs around cannabis use, that it is not harmful, that it is not addictive, and that it's relatively safe for most people, which is really not true. First, we know that cannabis use disorder frequently overlaps with other substance use disorders and mental health issues that impact overall health, and that people who suffer from psychiatric illness also experience elevated premature death rates. We also know that the leading causes of death for those with cannabis use disorder include suicide, with a tenfold increase in the risk of death by suicide in individuals with cannabis use disorder. But there are also a few other health problems that are leading causes of death for those with cannabis use disorders to be aware of. So those are opioid and other drugs. Again, strengthening that explanation that it could be tied to overlapping substance use disorders and mental health conditions, trauma, and lung cancer.